what is the connection between grain, inflammation, and weight gain?
Yeah, it's a great question. So many people have been kind of indoctrinated their entire life that grain is somehow this magically wonderful and healthy food. And as we see with breakfast foods, you've got bagels and oatmeal and cereals of a variety of different kinds. And so we've all been kind of told and brainwashed through marketing that without grain we would somehow cease to be healthy and have enough fiber or have enough nutrients in our diet. But the reality is that grain was actually banned in 1943. The U.S. government banned the sale of grain because it was killing people. And the way it was killing people was by inducing malnourishment. It was actually creating diseases like beriberi and pellagra. These are diseases of vitamin B deficiency. And so what the government mandated at the time was that in order to sell grain, you had to fortify it with synthetic vitamins to prevent these malnourishing diseases from setting in. And so this is what really began kind of this endeavor into the commercialization that grains are somehow healthy. What cereal manufacturers did at the time is instead of saying, don't eat us, we'll kill you, they said, eat more of us because now we're fortified and we're even more balanced and a complete part of your daily breakfast. So, and this is what most people in our generation grew up with, this message, just hearing this. They don't really understand that history. But grain in and of itself, one of the reasons why it's so unhealthy, aside from the fact that just eating it, it's not a very nourishing food, is that for many people, grain, and you've heard of gluten sensitivity, many people are actually gluten sensitive, which is, they have an immune response against one of the major forms of storage proteins in grains called gluten. And so then when they eat it, they actually, not only does it cause malnourishment, but it also causes an inflammatory response, creates their immune system actually goes after it and attacks it, and in doing so creates a chronic low-lying inflammation that contributes to leaky gut or intestinal permeability and also contributes to the development of autoimmune disease. But then you also have, aside from those, so there are some people who are gluten sensitive, but then you also have a number of other properties about grain as a food itself that have nothing to do with gluten that can trigger inflammation. And one of those properties was actually recently discovered. This discovery is only about 10 years old. There's a family of proteins in grain called ATIs. And ATIs, it's an acronym for amylase trypsin inhibitors. And these proteins actually shut down the human pancreas. They prevent the human pancreas from secreting digestive enzymes. And so and the reason why this is a defense mechanism, the grain is a seed and it wants to survive. It wants to perpetuate its own species. And because it can't run away from predators, it has to have its own unique methods of defending itself from predators. And so this ATI protein family is one of the defense mechanisms of grain. And what we've discovered is that these particular proteins, not only do they shut down the pancreas, but they activate a specific receptor in our intestines called a toll-like receptor, and that triggers this chronic inflammatory response. And on top of that, we have the fact that the way commercial grain is grown today, it's very, very heavily laden with pesticide, particularly glyphosate, or otherwise known as Roundup, and atrazine, which is another type of weed killer. And so these pesticides mimic estrogen, and they have inflammatory effects on our gut function. And then grain also has a heavy, heavy quantity of mold, particularly aspergillus and other types of mold grow on grain. So when grain is being stored in these big bins before it's commercially processed, it tends to grow a lot of mold. And so byproducts of grain, when studied and when measured, have high levels of mold and mycotoxin in them. So if we just look at grain as a whole, number one, it doesn't have a great history of being very nourishing. Number two, it's rich in proteins that are protective of the grain. Therefore, these proteins can create damage to humans when we eat these grains in mass quantities. Three, the pesticide issue. Four, we've got high levels of molds and mycotoxins. There are other things about grain that also create inflammation, but I think for the sake of our conversation today, we should kind of summarize with those four.
Very interesting. So somehow we've gotten from this concept of grains being malnourishing to eat your Wheaties, right, in the span of 40 30, 40 years, right? The public forgot about this history of grains as not being very nourishing, and then somehow that was like spun as a superfood. Then I don't know when, probably by like the 70s or 80s, right? That no one that history had been forgotten,
Well,
and
right.
then.
And so, yeah. So, I mean, even if we look at cereal itself, its history is only about 125 years old.
Hmm.
We didn't even have cereal prior to that time frame.
Hmm. Well, it's funny. Every time I've traveled to other countries, you wonder why there isn't 70 or 80 different brands of cereal in the grocery store shelf. In fact, you have to like cook something for breakfast in other countries, right? Unless it's like a baguette, right? But there's a dizzying array of cereals in our culture. That's something in a way that I was always proud of. I was like, look at all this variety, right? And every culture has this kind of like food art, the cuisine that it puts forth as its like artistic cuisine. And I've always considered American cookies to be a way of that we express ourselves and our culinary talent, but American cereals as well. And what you're saying is that this all started in response to this strange ban of grains and the requirement to fortify them because of their lack of nourishment. That's fascinating.
Yeah, and I think people just should understand that because in our society, especially in the U.S., the culture of food is it's a very, very big challenge socially. People get upset when you take away their food or when you take away their ability to produce foods,
Yeah.
especially among the baked goods. And a lot of the, obviously the grains go into making cookies and cakes and crackers and so
Yep.
many of the things that we gravitate toward, and as a manner to share love and to share the social kind of connections.
Yep. And ease of use and convenience. I mean, that the grains. It's not a surprise that we're eating food from a box for breakfast because people are rushing on their way to work. And so, what are people eating for breakfast? They're eating pre-made things, baked goods, cereals that you can pull right off a shelf. You're saying that this grew out of this law in 1943. Fascinating history. Wow, I'm really interested to research that a little bit more after our call, and thank you for bringing that to the awareness of our users. And then, of course, there's all this other inflammation issues beyond malnourishment that you brought up. Here's something else I'm curious about. I've heard that celiac is not actually an allergy to gluten. Can you tell me what is it if it's not an allergy to gluten?
That's a good question. So the way we define allergy, medically speaking, is an acute response to a food that produces the production of an antibody called IgE, immunoglobulin E. And so I'm being kind of nerdy and technical here, but an acute allergy is what most people think about as when they eat it, their lips swell, their throat constricts, they break out in the hives, they might have severe vomiting or diarrhea. It can create an emergency scenario. The kid with the peanut allergy who ends up in the hospital, that's the traditional allergy, and it's this very acute response. Celiac disease is not an acute response this way. Celiac disease is when the immune system, when what happens basically is that gluten damages the GI tract and triggers a release or a reaction where the immune system begins attacking our own intestines. And it is an immune response, but it's not an acute immune response. It's a chronic inflammatory autoimmune response. So the mechanisms are different and they're measured differently. So for example, if somebody goes to their doctor, says, "Hey, can you test me for a gluten allergy?" Understand that first of all, gluten is not defined as one thing. Gluten is this family of proteins. There are over 1,000 forms of gluten found in all grains. Wheat, barley, rye, oats, corn, rice, sorghum, millet. These are all grains, and they all have different forms of gluten. Gluten is not this singular term. So when they go to their doctor and they ask to be tested for an allergic reaction to gluten, that usually doctors don't even understand this. So what they do is they test for an allergic reaction to wheat. And so they're measuring this immune response to wheat only, and they're measuring the immune response that they're measuring is a specific kind of immune response. It's not the same kind of response that we would look for or measure for somebody who has celiac disease. So this is where it can get confusing because you may go to your doctor and get tested for wheat allergy, and then he says, "Oh, don't worry about gluten, eat it all you want," but you could actually still be gluten sensitive.
Mm-hmm. Mm-hmm.
And so there are specific ways that we would measure for gluten sensitivity versus there is really no such thing as gluten allergy per se. There's wheat allergy, there's corn allergy. You can be allergic to specific proteins and grains, but gluten sensitivity, which is the reason why the term sensitivity is used instead of allergy, is because it delineates that there's a different mechanism of action underlying how that person's immune system is responding to exposure.
So if they're doing that little skin test thing, it's not going to pop up in a half an hour. It's going to be something that that takes a longer time to show up and be measurable. Is that what you're saying?
Either that, or it's going to take a longer time to do enough damage to the tissue or the organ for it to manifest as disease symptoms.
Mm-hmm.
So kind of like this. An acute allergy is think of it like taking in poison that could potentially kill you right now. Okay, versus taking in something you're sensitive to where it doesn't kill you right now, but it creates damage, but the body is adaptable and resilient enough to offset and heal from some of that damage. But the more you get exposure over time, the more you overwhelm your body's resources of healing and repair until you get to the point where your body is no longer capable of healing and repairing that damage because it's worn out. And this is when the autoimmune disease sets in. That's why most people who develop autoimmune disease, they don't really get a diagnosis until they're in their 30s or 40s.
Interesting, very interesting. So then how do people know that they have a gluten sensitivity?
The best way to test for gluten sensitivity is genetics. The way gluten sensitivity works is when your body's exposed to gluten, if you have gluten sensitive genes, then what these genes do, we actually measure two different kinds of genes. They're called HLA-DQ genes. There's two of them. There's an alpha 1 version and there's a beta 1 version. And these genes their job is that they create an antenna that sits on the surface of our immune cells. So imagine our immune cells, as they float through the body, have these antennas that stick out from them. And the job of these antennas is to recognize things and help the body determine what is good from what is bad. And so if a person has a particular gene pattern on their HLA-DQ genes for gluten sensitivity, then what happens when they get exposure to gluten, their immune system picks that gluten up and says, hey, this is a bad guy. We need to figure out a way to deal with it. And so then we get this cascade of inflammation. But again, it's not an acute cascade of inflammation. It's a chronic cascade of inflammation. Mm-hmm. It's similar, John, to high blood pressure. High blood pressure itself is an inflammatory disease. But most people who have high blood pressure don't feel it, right? They don't feel the pain of high blood pressure. They go to the doctor, they get their blood pressure taken. The doctor says your blood pressure is high. It's a form of inflammation. Well, the same thing can happen with gluten exposure. You can get forms of inflammation in different areas of the body, in different tissues. Gluten sensitivity has actually been linked to more than 80 different medical conditions, and some would say over 100 different medical conditions, most of these being autoimmune diseases. So, for example, the inflammation of the thyroid or thyroiditis, also known as hypothyroidism and sometimes called Hashimoto's thyroidism, is an example of a gluten-induced autoimmune disease that affects the thyroid gland, as opposed to celiac disease, which is a disease of inflammation that affects the small intestine, as opposed to Crohn's disease, which is a autoimmune disease that affects the large intestine, as opposed to autoimmune hepatitis, which it can be caused by gluten, which affects the liver. So again, you've got all these different areas that can be affected. The way different people are affected by gluten is different for different people. Just like if we were to take 10,000 people, give them all the exact same dose of aspirin, they would all have different reactions and different responses, right? Yeah. Some would have no response at all, but some people would develop ulcers, and some people would have an anaphylactic reaction. Some people would end up in the hospital. Some people would have gastric bleeding or intestinal bleeding as a result of taking it. Some people would get relief from their headache. So you've got all these different people taking the exact same thing, having potentially different responses. So think of gluten much in the same way. It can affect different people in different ways.
Yeah, well, that's certainly very Ayurvedic, that a person's response is often dependent upon the weak link in the chain. If a person's liver is the weak link in the chain, then maybe they'll get that autoimmune hepatitis you're talking about. Or for whatever reason in their constitution, the reaction shows up in one place rather than another. And so most of the people who on Joyful Belly who are listening to this call will be familiar with that concept, that not everybody is reacting to things in the same way. And that complicates sometimes people's self-assessment, that they are wondering, okay, well, is this bad for me or is it not bad for me? You're saying that a definitive way to test is through genetics. Is that definitive? Are there false positives, false negatives, or are there other methods?
Well, to truly test for gluten sensitivity, no, there really aren't. I mean, there are other methods, but they're not, they're misnomered or they're mislabeled. So the only really true way to test for gluten sensitivity is to do genetic testing.
Mm-hmm.
Now, there are some blood tests that doctors will use. Let me give you a couple of examples. There's a test called anti-tissue transglutaminase. There's a test called anti-endomysial antibody test. Those are tests that measure for the types of antibody responses that we see in celiac disease. So this is why it can be confusing. Let's say that your doctor tests you for celiac disease and you don't test positive because your response to gluten wasn't a celiac response. So if that doctor is using celiac disease and gluten sensitivity as interchangeable terms, then you're getting a false result. Because everybody who's celiac has gluten sensitivity, but not everybody with gluten sensitivity will develop celiac disease. So if we measure for a particular specific disease and we find the person doesn't have that particular disease, if that disease is caused by gluten, it doesn't mean they don't have gluten sensitivity. Does that make sense?
Absolutely. You're saying that a person could be sensitive to gluten in multiple different areas of their body, and celiac disease is only one of the types of gluten sensitivity.
Exactly.
So if you get a test for celiac disease, then it could be insufficient.
Correct. And a lot of people get this. They go to their doctor and say, test me for gluten, and their doctor tests them for celiac. And because they don't know the difference, they get a negative result. They continue to eat gluten to their own, detriment.
Yeah. Yep. Now, and sometimes in Ayurveda, we do what's called an elimination diet, where we just remove it from the diet for a few weeks, or a week, or even 3 days in some cases, and see how a person feels. I mean, that's effective often, but sometimes there are multiple factors. A person could eat wheat 10 times and get the symptoms only 3 of those 10 times. And so it ends up being a little bit mysterious for folks. And it's not idiosyncratic when that happens. In Ayurveda, a person may be sensitive 3 out of 10 times because the other 7 out of 10 times, it might have been a good day for them. They might have been feeling strong, had a good night's sleep. The rest of their diet was pretty balancing for them, and their body's adaptability, as you mentioned earlier, compensated for that. So they felt relatively okay. Therefore, they become sometimes unsure or uncertain. Am I really gluten sensitive or not, because of that seeming idiosyncrasy or variability with how they feel after eating gluten?
Yeah, I couldn't have said it better. Very well put.
On a slightly different topic here, you do some work with muscle building hormones. Is it true that eating wrong foods can impact muscle building hormones? And is that related to gluten too, or is this another area that you work in? Can you tell us a little bit about how foods and muscle building hormones work together?
Yeah, absolutely. So one of the biggest problems, and I treat people who have autoimmune disease in my practice,
Mm-hmm.
and so one of the biggest problems that we see is these people they lack muscle. They have in effect they're under muscled, and some of them are obese, but some of them are thin, and they're what we call skinny fat. They don't have obesity or the outward appearance of being overly fat, but they don't have muscle tone and they don't have adequate muscle tissue. And so one of the reasons why is the impact that food has on muscle growth, on muscle building. Actually, we call it the gluten muscle wasting cycle as it relates to gluten, because what happens is if you eat a food that creates a chronic state of inflammation, then the hormonal response by the body is one of excessive cortisol release. And as cortisol is being released, it causes water retention, and it's a catabolic hormone, so it breaks down muscle tissue over time. So the body is busy trying to deal with the inflammation that's caused by the food, that it doesn't have enough resources for muscle growth, muscle maintenance. And so we get a slow and steady muscle loss over time. And then this subsequently can now start to affect blood sugar levels, because a big part of what the muscle does is it regulates energetics and regulates basic metabolic rate of the body. So we end up having a person who starts to develop these lows and highs, these hypoglycemic episodes, because it's affecting their insulin. At the end of the day, their insulin levels are having to overly compensate for this imbalance, and so we get excessive insulin production, excessive cortisol production, which stimulates fat gain and stimulates muscle loss. But then we also have the fact that when foods create inflammation on an excessive day-to-day consumption, we're creating inflammation with the food that we're eating, and that inflammation, it basically has to be dealt with by the body. The body has to create antibodies against the food. It has to create proteins that help to stamp out the inflammation. And sometimes if the diet is poor and high in carbohydrate, or too high in carbohydrate, not high enough in protein, then the body will start using muscle tissue as a reserve tank to fight this immune inflammatory war against the food that a person's eating. So your body actually starts stealing and raping the muscle tissue to feed this war against the food. And so over time, we get aggressive atrophy of the muscles. And of course, why is this so important? It's important because we need muscle tone. It's the number one in science. It's the number one predictive value of longevity. In other words, if we could only measure one aspect of human health, measuring muscle density would give us the greatest ability to predict somebody's likelihood of a premature death. And so that's one of the reasons why it's so important. But one of the other reasons is that muscle itself is necessary as a pumping system for the lymphatic fluids. And so the lymphatic fluids, which is a huge part of our immune system, are pumped through the body through action of muscles. So if we have all this muscle atrophy, again, as a result of food-induced inflammation, then we now start to suffer with immune suppression because the lymphatic fluids are not flowing appropriately. But then the other aspect to that is that the muscles themselves, as they atrophy, the joints become compressed, so that when the person does try to get up and does try to exercise, their joints and tissues, so their knee joints are more compressed. They're in a tighter situation. Their hip joints are tighter. Their shoulder girdle's tighter. So now when they start to try to exercise, there's more wear and tear. There's more friction. And so we get stuck in this kind of phase, this vicious cycle, this muscle wasting cycle, where we've lost muscle. We try to exercise to regain it, but the atrophy has led to compression of joints, which then causes wear and tear and friction and arthritis. Every time we try to exercise, it induces that arthritic pain. And so then we avoid exercise. And then when we avoid exercise, we develop more muscle atrophy. And because we're eating foods that also continue to perpetuate inflammation, we just get stuck in that vicious cycle. Mm-hmm. So a big part of the way out of this, obviously, is through change of the diet. We try to change the diet to accommodate the immune system, to accommodate a lower level of inflammatory kind of response. And then we implement exercise, and particularly before we implement a lot of weight training or heavy exercise, we implement a lot of flexibility training, because we really, really want to get the muscles in an elongated state so we can open those joints up before we put them under stress and duress. And so again, yoga is really good for this. Just generalized stretching of the joints is very, very good for this before we really get into a kind of a body weight resistance-based activity program for somebody to start recovering their muscle tissue.
Great for people to think about: joint compression, opening up and elongating the muscles, and this muscle tone being a number one predictive value of longevity. I'm going to highlight that in my notes here, something that I want to remember and take a look at. And also this idea that if people are perhaps gaining weight and losing muscle tone due to eating an inflammatory diet. You said that in so many words, and I just want to say it again to make sure people hear that an inflammatory diet is causing that lack of desire to exercise, even lower metabolic rates, weight gain, and some kind of degeneration in the joint. I mean, ultimately, the degeneration in the joints itself. So, yeah, powerful connection there. So what is the prescription pain medication trap?
That's where we take that person that we just described who's eating an inflammatory diet and trying to exercise but can't because they've created a pain scenario. And so then they gravitate toward, over-the-counter pain medications or prescription pain medications, things like aspirin or ibuprofen and Tylenol, or if you go up even higher than that, you can get things like Celebrex or prescription ibuprofen or naproxen. And some people even gravitate toward steroids, toward using corticosteroids as a means to control the inflammation. And even in some cases, people gravitate even to higher levels of medications like opiates. So this would be like Vicodin and morphine and some of the other really powerful pain medications. Unfortunately, these medications are responsible for over 32,000 deaths a year. And I don't mean overdoses. I mean the normal prescribed use. I'm just talking about regular daily use from people who are taking these just to kind of combat pain. 32,000 people every year die from their use. So the prescription pain trap is understanding that, number one, there's a risk of death when you use these kinds of medications. Number two, it's not like everybody drops dead when they use these medications, but some of these drugs actually have nutritional side effects. And let me explain. For example, aspirin. We'll use aspirin and ibuprofen because a lot of people will grab those things thinking they're relatively safe. Aspirin and ibuprofen cause iron, vitamin C, and folate deficiency. And why is that a problem? If we're using these medications long-term to manage pain, we start causing iron, vitamin C, and folate deficiency. And the reason we're taking the medication in the first place is because our joints are inflamed. Our joints, in order to heal and repair, need iron, folate, and vitamin C. So the very thing we're doing to fight the pain is actually causing a deficiency of substances that our cartilage needs to repair the inflammation. And that's why it's a trap. That's why I call it the prescription pain trap, is because we get these medications, we get used to taking them to control and modulate our pain, but we're not treating the underlying origin of why the pain is there. And then the secondary side effects of the use of the medication over time leads to nutritional deficit that makes it impossible for the inflammation and for the damage that's already there to heal. Now, on top of that, these medications have also been shown to cause intestinal erosion. Our intestinal lining is part of it is a mucosal barrier, a layer of mucus. And these types of medications actually erode that layer of mucus. That's why on the labels of these medicines, one of the warnings is this medication can cause gastric and intestinal bleeding. It's because it erodes the mucosal lining away and leaves the cells underneath barren and exposed to potential threats and dangers. And so we can get ulcerations and bleeding that occurs. And then that kind of occult bleeding over time leads to more iron deficiency. So then we get back into this, again, repetitive vicious cycle type of activity that the only way we can really stop it is to, first of all, identify where the pain is coming from, not mask it. The drugs mask it, but don't resolve it in a meaningful way that leads to a resolution of the underlying origin of the problem. So we first want to find out where the inflammation is coming from. And if it's food-induced or grain-induced, that's a pretty simple change. Diet change is pretty simple when you consider the grand scheme of chronic pain, chronic joint deterioration, and the path that leads to, the obesity that leads to, the heart disease that can lead to and contribute to, the cancers that can lead to or contribute to. So you kind of reverse engineering this whole process. If we get stuck with that whole, let's take the medicine to reduce the pain scenario, we have to re-engineer where the pain is coming from so that we can kind of cut the cord, so to speak, on the need for the medication in the first place.
Yeah. Now, the ease of changing diet, on the theoretical plane, we can talk about that ease of changing diet. What I notice with many of my clients is that emotionally, they're afraid to give up grain at times. They feel a kind of insecurity. What am I going to do? How am I going to survive? In a way, almost, it's very dramatic for them to even think about changing and moving away from grains. As a practitioner, I can do that pretty easily, eating mashed potatoes or something, right? So substitute
Right.
for grains. Sweet potatoes is a lighter option, or yams. And then, of course, there's other root vegetables as well that could provide kind of some substance to the diet. But, this gets to be an emotional issue for many of the clients that we see in our clinic. And one of the reasons why I wrote that book, Explore Your Hunger, just to help people deal with some of the emotional issues they have around food insecurities, around going off of of grains. Now, do you see that a lot? Do you see that resistance, or do you have a plan a specific kind of plan that you offer clients to get off grains?
So in my clinic, we do. Well, first of all, we test them. We don't guess. We want to definitively give them a solution that's right for them and unique to them. As you know, with Ayurveda, you try to give them what is unique for them.
Yeah.
And so we do a lot of scientific objective testing, genetic testing for gluten sensitivity. We test them for food allergies and sensitivities.
Mm-hmm.
So that we can come back and say, look, these are the things that you should look toward avoiding. And therefore, since we can't have these things, now we need to gravitate toward all of these other options.
Mm-hmm.
And so part of that is just working individually with each person on a one-on-one basis to try to kind of map out what their blueprint needs to be. In terms of general protocols, one of the things I have is, I wrote a book called No Grain, No Pain, where we map out a 30-day, 2-phase diet protocol with recipes and meal plans for people who maybe they don't want to do genetic testing, or maybe they already have this really strong suspicion that gluten is a problem or grain is a problem, and now they just kind of need a platform to follow or some advice or guidelines to kind of follow. And so we map that out in that book to a very fine detail.
Yeah, and even if they're not gluten sensitive, eating grains can cause other things: yeast infections, instability of blood sugar levels, just due to the kind of heavy dose of carbs in them. And so it seems like am I right that your book may even help those people wean off of grains as well? As sort of this definitive, here we have a definitive expert of gluten, not only gluten sensitivity, but somebody who has done this for so long that they have mapped out a strategy to wean people off grains. That sounds pretty valuable to me.
Yeah, I mean that's where, like you said before, the biggest challenge for some people is that emotional, social challenge. What are they going to do? What's next? They get the paralysis of okay, gosh, I don't know even know where to begin. So we try to map that out and give them that help and support. I think it's also important to note on the same topic, John, that one of the reasons people feel this way when they cut grain out is there's actually a drug-like withdrawal for some that can occur.
Absolutely.
There are a couple of proteins that have been identified in grains that mimic morphine.
Mm-hmm.
Uh, Primarily, one of them is called gluteomorphin. And so what happens when you cut this out of the diet is if a person has a in essence an addiction, right, a drug-like response to the food, then they go through kind of irritability and mood swings and the fevers and chills and low grade fever, low grade malaise and fatigue. It's not uncommon to see this. It generally will pass within 7 to 14 days of going onto the diet. So,
Mm-hmm.
if people are making this attempt, I just want them to be aware that if they're experiencing that, it's not that going on that diet is bad for them. It's that they're just experiencing a withdrawal
Yeah.
effect.
Yeah.
And a number of things can be done to kind of overcome that withdrawal. One of the things that absolutely is very, very helpful is increasing vitamin C and increasing B vitamins, particularly vitamin B3. These things can help make a withdrawal scenario much, much easier to deal and cope with.
Yeah, they're called comfort foods for a reason, but the comfort that a person experiences isn't necessarily authentic. It's not that the body is comfort, but that some chemical within the food is inducing an altered state within them. And so they shouldn't interpret that comfort that they feel after eating grains as, as the reality of what's going on in their body. Now, vitamin C, vitamin B3, does that make withdrawal easier for many kinds of drugs, or is this just specific to grains itself, the kinds of issues that people have when they're going off of grains?
It's alcohol, because most alcohols are grain based.
Mm-hmm.
So people going with alcohol withdrawal. Also, pain medication withdrawal. Well, it works well with these, as well as dairy and grain. So, persons finding that dairy is a problem for them, and the reason why is the kind of the backdrop with all of these things is that they all stimulate morphine-like receptors in the brain to give that drug high, so to speak. Mm-hmm. And so vitamin C helps with that withdrawal, and again, so does vitamin B3.
What are some other natural ways to reduce pain and inflammation?
Some of my favorite ways, number one is motion and movement. And so like for free, right? We can all get up and move. And it doesn't have to be severe or aggressive exercise. It can be just depending on the level where a person is. It could just be if they're very sedentary, it might just be toe touches. It might just be taking the arms over the head and just really stretching and rotating the torso a little bit, going for a longer walk. Getting the body moving again is very effective because what it does is it helps increase circulation of inflammatory compounds, and it helps the body deal with them faster and get them out of the body faster. So motion and movement is very, very important. As far as is natural things that can be done, there are a number of different natural anti-inflammatory foods. Probably some of the best anti-inflammatory foods are foods that are rich in omega-3 fatty acids. And so probably one of the better examples there is fish, cold water fish, particularly wild-caught cold water fish. We don't want farm-raised fish. Those, for example, Atlantic salmon is farm-raised. It doesn't have a very high omega-3 content. So that particular kind of fish won't have the anti-inflammatory benefit that we're looking for. If you're more on a vegetarian-based type of diet, chia seeds and flax seeds are higher in omega-3 that can be used as anti-inflammatory foods. Foods that are rich in phytonutrients and antioxidants, like the berry family, blueberries and strawberries, blackberries, goji berries, etc., all can be very effective anti-inflammatory foods. And supplementally, some of the things I like that I see work clinically the absolute best for inflammation. One is concentrated omega-3. And sometimes we get the doses up, concentrated omega-3s, and when I say concentrated, I mean high doses of EPA and DHA, up to 6 to 8 grams a day. So this is a very, very high quantity. Most over-the-counter products may contain about 1 gram in a serving size. So we're talking about a much, much higher dose to have a very, very good anti-inflammatory effect. Turmeric is another very, very effective spice at reducing and modulating inflammation. Works very well. Ginger works very, very well. Skullcap works very well. And so these are just some things you can do with your herbs, your spices, and your food. And then from a supplemental perspective, again, vitamin C, high doses, up to 5 grams or more a day. Fish oil, 4 to 8 grams a day, works very well. Turmeric, concentrated to 95% curcuminoids at about 2 grams a day, works very, very well. Proteolytic enzymes work very, very well if taken on an empty stomach at reducing pain and inflammation. So these are all just examples of things that a person can gravitate toward if they're struggling or wanting to have an alternative to the pain medication as they're making this transition to a healthier lifestyle.
Great. And how about exercise? For someone who may be overweight with chronic joint pain and maybe they're taking some of these supplements already. What else about exercise? You talked a little bit before about rotating the torso and other things, getting some movement. Anything else in the way of exercise there?
Yeah, so if they're really overweight, access to a pool might be extremely helpful because it emulates a zero gravity environment. We can do a lot of different forms of exercise in the pool that we might not be able to do originally or initially with gravity. Another one of my favorite is using the use of a whole body vibration platform. I don't know if you've ever used these or familiar with these, but a whole body vibration is a technology that was actually developed by the Russian space program because astronauts that were going up into space for 6 months at a time would come home with severe muscle atrophy. And, just like a person with an inflammatory diet can develop severe muscle atrophy, this technology was designed to increase muscle density quickly without putting too much stress or pressure on the joints because, again, they had so much atrophy, they were limited on what they could do. So these are platforms. I've actually seen a number of different gyms carrying these nowadays where you can go on just like they have a treadmill or they have an elliptical runner. Some gyms are now carrying whole body vibration plates. And so using these, it's a very great way, 10 minutes a day, 6, 7 days a week, to get a form of exercise that will increase bone density and muscle density, will help circulate lymphatic flow, but will not put a tremendous amount of pressure on the joints or cause an exorbitant amount of stiffness or soreness. And so this is a good way to kind of break exercise in, to start getting into exercise. I don't recommend somebody who's fully capable of exercise to just use a vibration plate. I think once you're capable, you've got to advance up the ladder and you've got to start doing more with your body's capabilities. But if you're just getting started out, pull work, whole body vibration platforms, both very, very effective. And then light yoga. Scaling the yoga. Yoga is a great way to get motion and movement without putting too much stress or duress on the joints for somebody who's just getting started.
Mm-hmm. Yeah, there's all different forms of yoga, restorative yoga, and all the way up to these kind of vigorous practices. So what flavor of yoga is going to work for you? You have that option. Great. This has been a fascinating discussion. I've learned a lot from it. I'm sure that our clients are going to learn a ton from what you shared with us today. I'm Dr. Osborne. How can people learn more? Just from what we've heard today, we can tell that you have put a lot of thought and experience into the recommendations that you're offering people. And how can people get more benefit from what you know about this?
There's a number of resources that I have for folks, John. I'd say probably my most comprehensive all-in-one resource is my book published by Simon & Schuster. It's called No Grain, No Pain. And that can be found at any major retailer across the country as well, Amazon and Barnes & Noble book buyers and Google Play and digitally it can be found. And then if they want to kind of learn more about our mission and what we do and learn more about my clinic, they can visit drpeterosborne.com. That's Dr. Peter Osborne, Osborne.com. And then I also have a foundation. If they want to know a little bit more about gluten and grains specifically, they can go to glutenfreesociety.org. That's glutenfreesociety.org. And we have a lot of great free resources there for people to tap into.
Great. A few good ways to connect with you. Thank you again so much, Dr. Osborne. It's been a pleasure talking with you, learning from you, and really look forward to sharing this with the folks at Joyful Belly.
Well, thanks so much for having me on, John. I'm always glad to come on and share information, and I really do hope that your audience takes away some valuable pearls from this, and that it can help change their lives.
Oh, they will. I'm sure of that.